Your dog's been dragging their rear end across the carpet again. You laugh the first time. You're not laughing anymore, especially since you caught a whiff of something fishy in the air a second later, and you're pretty sure it came from them. Most people assume this is just a weird dog thing. Or worse, worms. It's neither. And the actual fix isn't a $40 supplement or a monthly vet visit. It's a $2 can of something you've probably walked past in the grocery store 100 times without thinking twice about it. We look past the usual just squeeze it out advice you'll find everywhere online, because that advice is exactly how this problem gets worse, not better, and almost nobody explains why. Your dog has two small glands sitting just inside their rear end, and they're supposed to empty themselves automatically every time your dog poops. The stool passing through applies pressure on its way out. The glands release their contents along with it, and you never notice any of it happening. That's the system working correctly. It breaks down when your dog's stool is too soft or there's not enough volume to it, so there isn't enough pressure to actually push through and empty those glands. The fluid just sits there instead. Over time, it thickens, and once it's thick enough, it stops draining on its own, no matter how many times your dog poops afterward. That's when you start seeing the licking, the scooting, and that fishy smell that shows up out of nowhere. This part connects straight back to the food bowl. Stool that's consistently too soft or too low in volume is usually a diet problem before it's anything else. A lot of dry kibble is bulked up with grain and cheap fillers rather than real meat, and that kind of diet tends to produce exactly the soft, low-volume stool that stops those glands from doing their job. Diets built around real meat as the primary ingredient, whether that's a higher quality kibble or a fresh or raw diet, consistently produce firmer, bulkier stool simply because your dog's body processes real protein more completely and leaves behind more solid waste, instead of the looser, less substantial stool that comes from digesting a lot of processed filler. Fixing this starts with fixing what's actually causing the soft stool in the first place, not just managing the symptom after it shows up. There's more than one piece to this, and the dogs who actually stop dealing with this long-term are usually doing 2 or 3 of these together, not just one. So stick with it through all of them before deciding what to try. Cook pumpkin is the simplest place to start, and it's not just an old wives' trick. There's real substance behind why it works. Plain, cooked, pureed pumpkin, not the spice pie filling, is loaded with fiber that bulks up your dog's stool and gives it the actual firmness and volume needed to apply real pressure on those glands during a bowel movement. Mix about a tablespoon into their food for a medium-sized dog once a day, and give it a week or 2 of consistency before expecting to see a real difference. For a small dog under 20 pounds, cut that down to a teaspoon so you're not overloading their system with fiber all at once. For a large or giant breed, you can go up to 2 tablespoons, since their volume of food and stool is proportionally bigger too. If you want to strengthen that effect further, psyllium husk is the next step, and it works differently than the pumpkin alone in a specific way worth understanding. Psyllium absorbs water in the gut and swells into a gel-like mass, which does 2 things pumpkin alone doesn't. It adds even more bulk to the stool, and it actually regulates consistency in both directions, firming up stool that's too loose and softening stool that's too hard, which matters because both extremes can interfere with normal gland expression. Start with a small amount, about a 1/4 teaspoon for a medium dog mixed into wet food, and always make sure your dog has access to plenty of water alongside it, since psyllium needs fluid to actually work the way it's supposed to, instead of just sitting there. One habit that gets skipped constantly, and it's genuinely underrated. A warm compress can help relax the muscles around the glands and loosen up fluid that's already started to thicken. Use a clean cloth that's warm, not hot, and apply it gently to the area for 3 to 5 minutes before a walk. It's a small step, but combined with the diet changes, it gives that natural expression process an easier path to actually happen. Gut health plays a bigger role in this than the fiber alone accounts for. A dog's digestive system relies on a balance of good bacteria to process food properly and produce consistent, well-formed stool. And when that balance is off, from stress, a recent diet change, or antibiotics, stool consistency suffers along with it, even if the fiber intake is fine. A plain probiotic made for dogs, added to their food daily alongside the pumpkin, supports that balance from a different angle entirely. It's not a replacement for the fiber, it's working on a separate part of the same system. And the two together tend to produce more consistent results than either one alone. Don't stop here and go grab the pumpkin just yet, because the next part matters just as much as everything above it. Skip it, and you could end up undoing all of this without realizing it, or missing the one sign that tells you this was never a home fix to begin with. Now here's the mistake that makes this whole situation worse, and it's the one thing almost every home remedy list gets completely wrong. Don't try to express those glands yourself, and especially don't make a habit of doing it regularly just because you read that you can. Squeezing them manually, especially without knowing the exact technique, can irritate the tissue and cause the glands to secrete even more than normal going forward, which means you end up needing to do it more often, not less. It can also be genuinely painful for your dog if it's done even slightly wrong, and most people doing this at home have no way of knowing whether they're doing it right or just making things worse one squeeze at a time. Everything above works for the mild, ongoing case, but there's one thing worth knowing that changes everything about how you handle this. If your dog is just occasionally scooting or licking back there, with no swelling, no blood, and no sign of real pain, when you gently check the area, this is something you can genuinely help with what we just covered. But if you see swelling, redness, any discharge that isn't the normal thin fluid, or your dog reacts in pain when that area is touched, that's no longer a simple case. That's likely an infection or an abscess forming, and no home remedy touches that. It needs a vet, and soon, because an abscess left alone can rupture and get significantly worse. Checking this yourself takes less than a minute. With your dog standing comfortably, gently check the skin on either side of the anus for anything unusual. Normal skin here looks the same as the surrounding fur and skin. No redness, no puffiness. If anything looks swollen, shiny, or discolored compared to the rest, or your dog flinches or pulls away the moment you get close, stop there. That's your answer. And it points toward the vet, not the pumpkin. If it does come to that, it's a quicker visit than most people expect. Your vet will manually check the glands to see whether they're impacted, infected, or already forming an abscess. And depending on what they find, they'll either express them properly using the correct technique, which is a lot safer than guessing at home, or start antibiotics if there's a genuine infection. If an abscess has already formed, it may need to be drained under sedation, which sounds worse than it is and resolves the immediate pain fast. Either way, you walk out with an actual answer instead of another few weeks of home remedies aimed at a problem you never confirmed you actually had. Watch this over the next week or two, because it tells you exactly where you actually stand. If the scooting and licking taper off and that smell fades, the diet change is working and you just keep going. If nothing improves after a couple of weeks of consistency, or if things get worse at any point, especially any sign of pain or swelling, that's your sign this needed a vet from the start, not a stronger version of the same home routine. This is also useful to know if this keeps happening every few months, no matter what you do. Some dogs are just more prone to this because of gland shape or breed, particularly smaller breeds. And for those dogs, keeping fiber consistent in their diet long-term isn't a one-time fix. It's ongoing maintenance, the same way you'd manage any other recurring condition rather than treating it as solved after one good week. Weight and activity level matter here more than you'd think. A dog that's carrying extra weight or getting minimal exercise tends to have slower, more sluggish digestion overall. And that sluggishness affects stool consistency the same way a poor diet does. If your dog's diet already checks out, but this keeps recurring anyway, a daily walk isn't just good for their overall health in the abstract. It's doing something directly relevant here, keeping things moving through their system consistently enough that the whole natural expression process actually gets a chance to work the way it's supposed to. You didn't do anything wrong by not knowing this. Nobody explains the actual mechanism behind this, because just squeeze it sounds like a quicker answer than fix what's causing the soft stool in the first place. But the second one is the version that actually stops this from coming back every few weeks. If your dog's been dealing with this, start with the pumpkin tonight and give it real time before judging whether it's working. Subscribe and turn on notifications so you catch the next one before the next problem shows up. And tell us in the comments, has this happened with your dog? And did anyone ever actually explain why before now? We read every comment, and we want to know what people have actually been told versus what's actually true.